Welcome to Healthy Living, Healthy Planet Radio, sponsored by EarthX, the world's largest environmental experience, and also sponsored by Natural Awakenings magazine. Live your healthiest life on a healthier planet. Now here's your host, Bernice Butler.
Welcome to Healthy Living, Healthy Planet Radio today. We're now in our second season, and we're so excited to continue to help you explore and understand the unbreakable relationship between your health and the health of the planet. We look at the hottest topics related to our environment and its sustainability and how they affect your health and wellness. Here, issues like climate change, plastic pollution, extreme weather events, and others will meet up with everyday impacts like allergies and asthma, digestive issues and gut health, cancers, lung and heart issues, and more. So listen in today as we interview experts for today's show on extreme weather events, storms, flooding, and hurricanes. Climate change increases the risk of illness as well as other events related to extreme weather events. Scientists are detecting a stronger link between the planet's warming and its changing weather patterns. And though it can be hard sometimes to pinpoint whether climate change intensified a particular weather event, the trajectory is very, very clear. Hotter heat waves, drier droughts, bigger storm surges, and greater snowfalls. Climate change is expected to continually worsen the frequency, intensity, and the impacts of some types of extreme weather events. For example, sea level rise increases the impact of coastal storms, and warming can also place more stress on water supplies during times of drought. As more evaporation leads to more moisture in the atmosphere, rainfall intensifies. For example, we now know that the rainfall from Hurricane Harvey was 15% more intense and 3 times as likely to occur due to human-induced climate change. Also, we expect to see a higher frequency of Category 4 and 5 storms also as temperatures continue to rise. Now, this is a lot. So here today to help us unpack some of this is Dr. Nielson-Gammon with Texas A&M University. Dr. Nielson-Gammon, Ph.D., has been on the faculty of Texas A&M University since 1991. He is currently a Regents Professor of Atmospheric Sciences and also serves as the Texas State Climatologist. We are just so glad that he could take time to be with us today. Welcome, Dr. Nielson-Gammon, and I'm going to call you John.
That sounds good, yeah.
Thank you for being with us. Also, I wanted to add, because we're quite impressed, that you've done your research on various types of extreme weather, from droughts to floods, as well as air pollution, and you're also involved with computer modeling. And as a Texas State Climatologist, you help the state of Texas make the best possible use of weather and climate information through applied research, outreach, as well as service on various state-level committees, and you're a fellow of the American Meteorological Society. So again, we're just very glad that you could make time to be with us today. John, most of us feel that we are seeing and that we are experiencing more extreme weather, and perhaps some of the most extreme weather of our lifetimes. And that's of all types across the board. So can you tell us if this is really true, or are we hallucinating this? Or are we just feeling like this? And as an expert, how do you view the severity and perhaps the velocity of our storms, flooding events, and hurricanes? And then what is all of this telling us?
Well, as a general rule, extreme weather is increasing, but it depends a lot on the particular type of extreme weather. And it also depends on where you are as to whether it's affecting you. For example, there are parts of the United States where there's seen a big increase in rainfall overall, and so they haven't actually had any really severe droughts recently, so things are improving there. On the other hand, in especially West Texas and southwestern United States, rainfall has not increased, and the rising temperatures are making droughts worse. Temperature and rainfall sort of play with each other in different ways. You mentioned increased snow. That's true for places where it's consistently cold enough to snow, but on the other hand, places that are sort of on the margin will end up seeing less snow and more rain. So the generalizations don't necessarily apply to local spots where people live. Now, I can say that there are some aspects of extreme weather that really do tend to work across the board. For example, rising temperatures. Well, yeah, obviously heat waves are going to get worse. The rising temperatures are also affecting extreme rainfall, and in very predictable ways and some ways that are not so predictable. Predictable way is the higher temperatures lead to more water being carried around by the atmosphere, and so when it rains, it can rain harder. And the basic rule of thumb for that is about 7% more intense rainfall for every degree of warming that occurs.
That is, the hotter it is, the more we can expect more rainfall and more severe rainfall.
That's right, yeah. About 1 degree Celsius of global warming is what we've already experienced. And that's also what we've seen in the Gulf of Mexico, which is our main source of evaporated water for rainfall. So we should, just from that factor, have seen about a 7% increase in intense rain. And that seems to be what we see globally. Now, it can vary locally, it can change locally, because you can also get changes in weather patterns and changes in individual type of storms. So, for example, with hurricanes, we see that the area of rainfall with a given storm actually tends to be smaller. So you get more rain in a smaller area, which makes it even more intense rainfall. So that's presumably why we get a 15% increase with a storm like Hurricane Harvey. That's not just extreme rainfall. We also get changes in the storms itself that are affecting things. And so the analysis I've done for most of the central and eastern United States along the coast says that intense rainfall has gone up by about 11% thereabouts over the past half century or more. And that's a trend we do expect to see continuing.
Just so everybody understands again, the atmosphere soaks up or sucks up moisture into the air from the oceans and the bodies of water, and then that then produces that rainfall. But the hotter it is, the more rainfall there is, and the more intense is the rainfall.
Yeah, the higher temperatures allow more water to be carried around. It doesn't mean that the total amount of rainfall is going to increase, because there's only so much energy available to evaporate the water.
Right.
But the intensity of the rainfall goes up. And of course, that's also a problem for drought, because if you have more rain, you have the same amount of rain in a narrower time window, you've got more extended periods of drought in between. So Texas seems to be in sort of that sweet spot where you can actually have both droughts and floods getting more intense.
Let me ask you this, though, John. Let's talk about what causes the thunderstorms that we so often see.
There are three different types of thunderstorms that the scientists tend to recognize. One is a fairly ordinary storm, which actually gets called an ordinary thunderstorm, which hence the name, of course.
Yes, okay.
They tend to have a pretty short lifetime, maybe a half hour to an hour. The other two types can be a lot more severe and a lot more sort of organized. They effectively have their act together. One is things like a squall line, which the storms sort of line up and produce a gust of wind ahead of them, and these things can last for several hours. And the third kind is a supercell, which is spinning and is what produces most of the tornadoes. And the challenge with projecting those is climate models can't simulate a tornado or a thunderstorm directly. They're so small. So the best we can do is say, well, it looks like the instability that drives them is probably going to increase, and that probably is going to make them more intense, but we really don't know for sure, and we don't really have records going back many decades to tell us whether there's been a trend.
And so the tornadoes are basically spur-of-the-moment type things is what I kind of hear you saying. Because I know last year when we talked about this, and you were on our show last year, so we're so excited that you could join us again. And I don't know if it was you or someone else told me that there's just really not a lot of research on tornadoes. We cannot tell a lot of things or predictions on tornadoes as we can with hurricanes.
That's right. In terms of climate change and extreme weather, tornadoes are one end of the scale where we really don't have a solid evidence for thinking exactly what's going to happen.
Exactly. And we're going to go to break now, but we will be right back after the break with Dr. John Nielson-Gammon with Texas A&M University, who is also our Texas State climatologist, so he can continue to make us smarter about all these extreme weather events. Thank you. We'll be right back on the other side. And we want to give a shout out now to our sponsors. That is EarthX, the world's largest environmental experience, promoting environmental awareness through expo, conferences, film festival, interactive experiences, and now EarthX TV. Our other sponsor is Natural Awakenings Dallas-Fort Worth Magazine, the Green, Healthy, and Sustainable Living Authority for the DFW Metroplex and North Texas communities. Print issues of Natural Awakenings can be found in all Whole Foods markets, natural grocers, Central Market, Sunflower shops, and many, many other locations, as well as available free for download online at nadallas.com. Our other new sponsors are North Haven Gardens, serving the Metroplex since 1951, the most respected horticultural establishment in North Texas, offering gardening, plant education, DIY classes, and the best Christmas trees in Texas, we're told. Check them out at nhg.com. Our other sponsor is Lynn Dental Care, practicing dentistry for over 38 years with a holistic approach, looking at the whole body, specializing in periodontics. Dr. Lynn is board certified by the International Academy of Oral Medicine and Toxicology. Check them out at lynndentalcare.com. Thank you, sponsors. Welcome back to Healthy Living, Healthy Planet Radio. We're back with our show on extreme weather events, talking specifically about storms, flooding, and hurricanes. And we are back with Dr. John Nielson-Gammon with Texas A&M University, and he is our Texas State climatologist. Again, thank you for being with us. Now, right before the break, John, you were making us all smarter about rainfall and the things that cause it. So I want to talk about how rainfall, hurricanes, and tornadoes are related. And I think we had begun to talk about that before the break. But how are all those interconnected, or where do they intersect?
Yeah, so they all involve moisture in the atmosphere being condensed and producing energy for the storms. They all involve air rotating, the spinning up, and they also can be part of the same storm system. Tornadoes are small. The biggest tornado is a couple miles across, whereas typically even just the eye of a hurricane will be a lot larger than that. And hurricanes themselves can actually produce tornadoes. We had quite a few tornadoes with Hurricane Harvey, for example, and one of the quandaries that the Weather Service was dealing with in Harvey was, do we need to warn people about tornadoes when the advice we give to tornadoes is get in the basement, and the advice we're giving for a hurricane is get above the floodwaters? It's like, what do we really want people to do? Because you got these multiple hazards we can deal with one of them at a time, but when they all come at the same time, it makes it challenging.
John, what do you consider to be the worst of these extreme weather events, and why do you consider it to be so?
Well, in terms of economic impact, it definitely seems to be hurricanes, at least for the state of Texas, for example. And, of course, hurricanes that hit the state of Texas that be private economic impact for the entire country, not just because of the difficulty getting businesses back on their feet, but also just the expenses of damages from hurricanes and other natural disasters are borne by the taxpayers across the United States.
That was economic. What would you say in terms of effect on human life or other aspects of the environment? Which would be worse?
Well, let's see. Tornadoes are probably the most dangerous for people in the sense of, we can see a hurricane coming. a day or two in advance, and we can make preparations for it. Tornadoes, they don't strike without warning, but usually all you know is there might be some tornadoes somewhere, and then 10 minutes before it strikes, there's one coming toward you. So it's very difficult to really prepare yourself for a tornado the way you can, in principle, prepare yourself for a hurricane. Although part of the problem with hurricanes is to prepare yourself, you need to evacuate, especially for people living on the coast. And people have different means of being able to evacuate. They may have jobs that require them to stay in a particular location, or they may not be able to afford to pack everybody up and go to a hotel room and so forth. So you get this different economic impact with hurricanes that doesn't apply so much with tornadoes. An F5 tornado is going to take down a house no matter how well it's built.
In actuality, we see that the different extreme weather events are obviously coming more often, and they come in different places, but they always seem to be here.
Yeah, Texas. Well, of course, Texas is a big state.
Yeah.
Someone was actually talking to us about things going on in Europe, and they said, "Look how big this country is." And I looked at it on the map compared to Texas, and gee, that wouldn't even reach to Houston. Come on, Texas covers everything. We're sort of at the ground zero, though, because we got the coastline, we got the hurricanes, we've got the tornadoes, we get ice storms in North Texas fairly frequently. About the only thing we managed to avoid is earthquakes and volcanoes. But even the earthquakes may be coming along because, at least in the mild sense, because of some oil exploration. So, yeah, exactly. we basically get it all. And, of course, droughts. They haven't even mentioned droughts.
How do these environmental issues and costs impact our infrastructure and economy? And you've mentioned economy just a little bit, but I think infrastructure is pretty important, too.
Yeah, I mean, what we see as the risk of flooding gets reevaluated. In many parts of Texas, the new estimates of the amount of rain you'd expect to see maybe once every 100 years has gone up by 20 or 30%. And so as they figure out how big the floodplain is now compared to what it used to be, that's going to increase the cost of building in those areas. And it also increased the cost of living in those areas. I mean, Congress tried to cut back on flood insurance to make people less likely to live in places that are prone to flooding. But if you bought a house that was outside the floodplain and it gets reevaluated into the floodplain, you don't need a natural disaster to cause you economic hardship, because suddenly it's more expensive for you to live in your house because the flood insurance that you have to purchase is very expensive. And you may say, well, I can't afford that. I'm going to have to sell and move someplace else. The value of your house just went down dramatically because nobody wants to buy a house in a floodplain if they can avoid it. So this is sort of the silent natural disaster where it hits families very hard in particular places because the risk sort of crosses the threshold that society says, yeah, you're okay, or all of a sudden, no, you're subject to flooding, even though it's all continuous.
I have to think, or maybe I would like to think, that there is national or statewide or maybe regional activity and efforts to look at the infrastructure, but also to redesign requirements for infrastructure, taking into consideration some of these extreme weather events that we've seen and that we anticipate. Has there been anything of that nature?
We're trying to move toward resilient infrastructure. Understanding that the risks are changing and making it possible to adapt the infrastructure to those risks. So, for example, if you're building a new reservoir, you want the reservoir to be able to withstand the biggest flood that you could imagine happening. Well, our imaginations are growing. We didn't imagine Harvey before. Now we can imagine it. And in fact, if Harvey had followed one of the tracks that was forecasted earlier, we would have seen even more intense rainfall in the Houston area. But so now engineers are allowing for an additional margin for error in their construction. And one of the first things they did in Houston after Harvey was say, okay, let's allow for a 500-year flood rather than a 100-year flood, and let's build 2 feet or 3 feet higher rather than just 1 foot higher. The Dallas area hasn't gotten a lot of heavy flooding recently, certainly nothing like Harvey. So the latest updates of flood risk don't show a big increase, even though we know from climate change the underlying risk is creeping up. So I think as a result of that, Dallas is relatively unprepared for the intense flooding of the future, whereas Houston is probably well prepared based on what they've experienced.
I have to think, though, that Dallas put something into codes or infrastructure construction that accounted for the destruction we saw last year with the tornadoes, though. I mean, it just wiped away everything in its path.
I don't know what they've done for building codes for tornadoes recently,
Right.
But the government is trying to figure out how to assess flood risk in a changing climate and not have to always be behind the curve and say our risk is whatever happened in the past. Our risk is what's going to happen in the future, and the more we can prepare for the future, the more resilient we can be for it.
Exactly, because with people like you, where through your research and what you do, we can tell some things about future trends for weather events, then we should be proactive and look at that. I know with the South Florida Building Code, which is one of the most stringent in the world, I know it was upgraded several years back after they had a very, very, I think it was Andrew. And after that, they increased the wind resistance for windows and things like that. So I have to think that we need to be doing a lot more things like that as we are clearly in the space of climate change. One thing, we just have just one more minute to go, John, and I want to ask you really two things. What keeps you awake at night as a climatologist about our extreme weather events? And then what can ordinary people do in their everyday lives to help drive solutions?
Well, what tends to keep me awake at night is trying to hit a deadline for finishing up some research on extreme weather. That's the part that really worries me. I have to take the long view. I've been a state climatologist for over 20 years now, and I know that people aren't going to change what they do wholesale just because some scientist told them what to do. Hurricane Harvey actually made it possible to see what extreme weather can do, and it makes it easier then to believe the statistics and understand what those statistics mean. So the part that bothers me is you actually have to have a natural disaster before you realize what a natural disaster can do. You can tell people to trust the scientists, but intellectual trust is not good enough. People have to actually be able to see it to be able to understand it.
They do, and that's part of the goal of Healthy Living, Healthy Planet Radio, though, is to help ordinary people understand how environmental impacts affect them and their health and their life. So you are helping us push that needle forward. John, we really appreciate your time. We thank you so much for being with us. We've been with Dr. John Nielson-Gammon, Texas A&M University, and the Texas State climatologist. And he's made us smarter and helped us to understand some very significant aspects about extreme weather and how it affects our health. Thank you, and we're going to see you on the other side after the break for part 2 of our show as we now drill down on the health impacts of these extreme weather events. We'll be right back. Welcome back to Healthy Living, Healthy Planet Radio. To today's show on extreme weather events, talking about storms, flooding, and hurricanes. Now, climate change increases the risk of illness through increasing temperature, more frequent heavy rains and runoff, and the effects of storms. Health impacts may include gastrointestinal illnesses like diarrhea, effects on the body's nervous and respiratory systems, or liver and kidney damage. Extreme climate events are expected to become more and more frequent as a result of climate change, and climate extremes can have devastating effects on human societies. History records widespread disasters, famines, and disease outbreaks triggered by droughts and floods. And these complex, large-scale disruptions used to exert their worst effects in poor countries, but now even the richest industrial societies are not immune. Extreme weather events are by definition, or they were by definition, rare events. And many are more complex event-driven extremes like droughts, floods, and hurricanes, but these do not necessarily occur every year at a given location. But now we see they are occurring somewhere almost all of the time. And all of these have very significant impacts and consequences on our health. And here today to help us unpack this some more from a health perspective is Dr. James Diaz. He's an MD and a PhD, and he is professor at the Louisiana State University School of Public Health, and he is program director of Environmental and Occupational Health Sciences. Dr. Diaz is also professor of anesthesiology and critical care medicine in the Department of Anesthesiology at the LSU Health Sciences Center School of Medicine in New Orleans. And his specialties are in public health and tropical medicine. Dr. Diaz is a fellow of the American College of Occupational and Environmental Medicine, and his current academic and clinical research interests include occupational and environmental toxicology, infectious diseases, poisonings, and emerging environmentally associated diseases, particularly foodborne, waterborne, and vector-borne infectious diseases and poisons, and the impact of climate change on natural disasters and their public health outcomes. Welcome, Dr. Diaz. I'm going to call you Jim. Welcome.
Good to be here.
Now, Jim, can you give our listeners an overview of how storms, hurricanes, and flooding are connected to public health and their own individual health?
Well, they are interconnected, and we have heard from Dr. Nielson-Gammon that as temperature rises, moisture in the atmosphere increases, we have more rain. As the polar ice caps melt, the seas take on more water from rain and from melting ice. Sea levels get higher. As a result of increasing temperatures, sea levels get warmer. So it's warming seas that hurricanes are spawned from, and we're seeing more hurricanes. So frequency is increasing, intensity is increasing, and about the only thing we truly can't predict well at this time is exactly where the hurricane can hit. Over the past year, we've been in the cone of uncertainty, which means you could be a direct hit from a hurricane here in New Orleans 8 times. 2 weeks ago, we were hit directly by Hurricane Zeta. The eye of the storm passed right over the city as a high Category 2, winds of around 110, highest winds in the city, much higher at the coast. So it was Category 3 at the coast. Now, the issue with human health, the best advice that we give is to evacuate. Because if you look at deaths in hurricanes and flooding events, the most common cause of death is death by drowning. And the drowning occurs as a result on the coast of a storm surge. And many times the storm will come in at the astronomical high tide. So now you have high tide and you have storm surge. So that's number one, death by drowning. Number two, if you're like me and you're going to weather the storm like I did from Hurricane Zeta, because our climatologist told us that by the time it got to us, it would be a 2. So I stuck it out. If you stick it out and you're willing to lose power, which could be very dangerous for somebody who needs power, for example, someone on dialysis or on a breathing machine, they need to evacuate in advance of the storm. But if you're going to stick it out, the second most common cause of death immediately after the storm is an injury. And the injuries that occur are being struck by falling debris like tree limbs and being electrocuted from down power lines, particularly if you're in water or your home has been flooded. So electrocution. So injuries, including blunt injuries from tree limbs, electrocutions, and then lacerations, particularly if you're using a chainsaw. Even if you're an expert with the chainsaw, you wouldn't believe what I saw some experts doing with chainsaws after Hurricane Zeta. They were hoisting them up into tree limbs on a rope with the chainsaw actually on. So I've seen limbs amputated by chainsaws. So these are the most common injuries sustained during hurricanes and heavy floods. And every hurricane, as Dr. Nielson-Gammon mentioned, is a different event. Every hurricane is entirely different.
I think there's some other, perhaps, I don't know if you call them environmentally related diseases that can happen from some of these events as well. Can you talk to us a little bit about those?
That's right. And one of my areas of interest is arthropod-borne diseases, that is, diseases transmitted by insects. And these are the most common diseases, infectious diseases, new and emerging infectious diseases in the world right now. A great example would be Lyme disease, for example. It's transmitted by a tick bite. So the diseases that we're interested in that could be related to either an insect or an animal vector after a prolonged flooding event, such as after a hurricane or just after heavy flooding, would be diseases transmitted by mosquitoes, number one, and diseases that could be transmitted by rats, number two.
Most of us have heard at least something about the diseases transmitted by mosquitoes. That's what you call the vector, that's part of the vector-borne illnesses. I don't hear a lot of conversation, though, about rats. What do they transmit and how do they transmit it?
Well, rats can actually carry a large number of pathogens. And in the United States, the diseases that we're concerned about with prolonged flooding are basically leptospirosis. And leptospirosis is a febrile disease and caused by a bacterial spirochete. If we can make the diagnosis early, it can be easily treated. The problem with leptospirosis is that most rats carry the disease, that is, they carry the pathogen. They're not sick. They actually infect the environment by excreting the pathogen in their urine, and it ends up in the soil, in the sediment, and in fresh water in particular. So if somebody is wading or swimming or ingesting or even getting contaminated fresh water in their eyes, they can develop leptospirosis. The military, in fact, the Navy and Marines know more about leptospirosis than anyone because a number of recruits will actually contract leptospirosis in training exercises where they're required to swim across freshwater bodies. So leptospirosis is considered now the most common emerging tropical disease in the world. So that's number one, leptospirosis. Number two, transmitted by rodents, is hantavirus. Hantavirus is a climate-associated disease, and it's associated with two conditions. And we have seen this in Texas and out west, and we've also seen it in Louisiana. It's uniquely carried by rodents. The viruses are uniquely carried by rodents. First, there's a drought. Then there's a rainfall. And whenever it rains heavily and it floods, rodents move inside. They move inside closer to humans. They leave their condos, they leave their rodent condos in canals and drainage ditches, and they move in with humans.
Thank you, Jim. We're going to go to break now, but when we come back, I want to come back to leptospirosis and hantavirus. So we'll be right back on the other side of the break. Thank you. We've been with Dr. Jim Diaz with LSU. Thank you. And thank you, sponsors. And we want to give a shout out to those sponsors. That is EarthX, the world's largest environmental experience, promoting environmental awareness through expo, conferences, film festival, interactive experiences, and now EarthX streaming TV. Our other sponsor is Natural Awakenings, Dallas-Fort Worth Magazine, the Green, Healthy, and Sustainable Living Authority for the DFW Metroplex and North Texas communities. Print issues of Natural Awakenings can be found in all Whole Foods markets, natural grocers, central markets, sunflower shops, as well as many other locations, as well as available free for download online at nadallas.com. Our other new sponsors are North Haven Gardens, serving the Metroplex since 1951, the most respected horticultural establishment in North Texas, offering gardening and plant education, DIY classes, and we're told the best Christmas trees in Texas. Check them out at nhg.com. And our last sponsor is Lynn Dental Care, practicing dentistry for over 38 years with a holistic approach, looking at the whole body. Specializing in periodontics, Dr. Lynn is board certified by the International Academy of Oral Medicine and Toxicology. Check them out at lynndentalcare.com. Thank you, sponsors. Welcome back to Healthy Living, Healthy Planet Radio. We are back with the last segment of today's show on extreme weather events, talking about storms, flooding, and hurricanes. And we're with Dr. Jim Diaz, MD, PhD, with LSU School of Public Health. Again, thank you so much, Jim, for being with us today. Before the break, you told us that there are two diseases, kind of environmentally associated diseases, we're seeing more and more of that are caused by rats, and that is leptospirosis and hantavirus. For each one of those, could you tell us the manifestations? What happens to a person when they have those, or how do they know they may have those?
Well, first I'd like to say that mosquito-borne diseases are much more common than these rodent-borne diseases. Mm-hmm. The rodent-borne diseases are rare, but when they happen, they can be very serious, and we don't want to miss them in our differential diagnosis. So we have to realize that they are indeed associated with flooding events. So first off, we have leptospirosis, which is a bacterial disease caused by a spirochete of the genus Leptospira, and most rodents actually carry this bacteria, but it doesn't make them sick, and they excrete the bacteria in their urine. And the urine ends up in the sediment of bodies of water, like freshwater lakes. It lives in a freshwater environment. So anyone who is swimming, for example, or trying to escape without shoes on in a flooding situation after a hurricane and has a laceration on their foot is at risk of acquiring leptospirosis. Good news is most people may have encountered leptospirosis before, especially if they swim in bodies of fresh water. Number two is a much more serious disease, and that's the hantavirus disease.
Yeah, I've heard of that one before.
Yes.
I'm sorry.
In the United States, hantavirus diseases cause what's known as the hantavirus pulmonary syndrome. It's a viral disease. We cannot treat it with antibiotics, and about a third of the patients who develop hantavirus pulmonary syndrome die. Hantavirus disease occurs regionally in pockets of the United States, particularly the western United States, but it has occurred throughout the United States after flooding events. What happens is the rodent vectors, which are typically mice, they have experienced, for example, heavy rainfall, and there's been an abundant seed crop for them to eat, and then they experience either a harsh winter or another heavy rainfall pattern, say after a heavy flooding or heavy snowfall. So they decide to move in to human environments. In fact, it looks very much like a COVID infection.
Yeah.
And it is actually part of the differential for COVID-19. The unfortunate thing is, like COVID, it's a virus, so we can't treat it with an antibiotic or antibacterial agent. So it can only be treated supportively, just like COVID-19, with oxygen and with other therapeutics, maybe steroids, maybe some antiviral agents like ribavirin, just like remdesivir in COVID-19. Right. So it is a very similar disease. HPS is a similar disease to COVID-19.
Which also leads me to something else that I've heard you mention before, and that is the soil contamination that can occur after these storms, because it occurs to me that you could be exposed to both of these diseases you just mentioned via the soil without ever having seen a rat anywhere.
That's correct. So soil can be contaminated with either infectious agents, pathogens like bacteria, like the leptospira bacterium, or viruses like the hantavirus. But the concern that we have is what's left after a flooding event. What's left in your house? What's left in your yard? Sludge. Nasty, stinking sludge. And it's the chemical contaminants that we're most worried about. So if you think of the chemicals that are in your car, it includes gasoline, brake fluid, transmission fluid. These are all dangerous chemicals to be exposed to. The only good news is they're volatile chemicals that will evaporate in the sunlight when the sun comes out after the flooding event. What else can be in the soil? Lead and other heavy metals, particularly lead and arsenic. The good news is we're aware of lead poisoning, and there have been several federally sponsored programs to remove lead from gasoline. So lead is not in gas anymore, and to remove lead from paints. Nevertheless, many houses were painted before lead was removed from paints, and many houses still have lead pipes. Their plumbing may be lead-based. Right. So lead can still get in the soil after a flooding event. Next, we're also worried about arsenic. Arsenic is highly poisonous in its inorganic form. People ask me all the time, how can arsenic get in the soil in my house after the flood and outside in my yard after the flood when I told all the kids to go outside and play? Here is the problem. Until very recently, most fascia boards, most plywoods, most outdoor furniture were impregnated with types of arsenic to keep the insect pests, particularly the termites, from eating the wood. And they were impregnated with chemicals that contained arsenic, particularly copper chromated arsenic. We now have alternatives.
Fascinating. There's so much out there in our environment that's working against us.
What we really want to do is test the soil, and if we need to remediate it, we want to remediate it as soon as possible. That means we need to dig it up and move it to a hazardous waste facility and replace it with soil that doesn't contain heavy metals.
Is it now, or do you see it becoming in the future a part of standard operating procedure to test soils after some of these extreme weather events?
No doubt about it. After Katrina, there were groups that came into New Orleans and Mississippi Gulf Coast directly from the CDC and from the Agency for Toxic Diseases, agency ATSDR, and they were testing soil immediately, right away. The good news is a lot of the petrochemicals evaporated in the sunlight. The other good news is a lot of the pathogens were killed as the soil dried out. The bad news is some of the lead and arsenic remained in the soil.
And what you're referring to is after one of the big exemplary extreme weather events of Katrina and I imagine Harvey too. But what about the everyday flooding or thunderstorms that we might get up here in the interior areas? I have to think that some of the same hazards could be attended.
Yes, particularly if it's a serious thunderstorm and you've lost a lot of fascia board and it gets ground up and put into a hole or soil nearby, particularly in older areas of the inner city where there's a lot of apartment buildings, for example, that have been painted with lead-based paint. It just gets into the soil and it stays there. It stays there forever.
It appears as though soil testing needs to be something that's done more often and more systematically, and actually it should be something that individual homeowners or everyday people might want to become aware of so that they can do it to see some of the things that they be exposing themselves and their families to.
Absolutely. We need to do more soil testing. It's something we ordinarily will forget about.
We'll have to promulgate that more, you and I. So, Jim, last thing, 2 questions. What keeps you awake at night as it relates to our public health and our extreme weather events that are being caused by climate change? And then what can ordinary people do in their everyday lives to help drive solutions?
Well, what keeps me awake, really, having been through so many of these, going all the way back to Betsy with my parents, if you've been ordered to evacuate, please evacuate. It's very difficult at this time of COVID-19 to go into a shelter, but all of the steps are being taken in shelters to provide for mass and social distancing. If you can visit friends and family outside of the impacted area, please do so, because the risk of your being injured or your being very severely inconvenienced by prolonged loss of power is great. Certainly, if you have a chronic medical condition, you need to evacuate. You need to evacuate with your medications. If you require power because you're on a breathing machine, or even if you need a CPAP machine at night, please evacuate. What keeps me awake is people are not heeding evacuation orders.
Thank you so much for helping us unpack this today. This has been very informative, and I hope that it's really given our listeners some empathy toward the environmental and health impacts of these extreme weather events. Thank you so much. We've been with Dr. Jim Diaz from LSU School of Public Health. And thank you, listeners, for listening in today to Healthy Living, Healthy Planet Radio. The conversation starts here, but our goal is for it to continue in your home, in your social circles, your workplaces, at the water cooler, and in the grocery checkout line, so that we can all work together to realize that healthy living is simply not possible without a healthy planet. Our culture is a result of a trillion tiny acts by billions of people every day like yourself. And each of these tiny acts can seem insignificant, but all of them add up one way or the other to the change that we each live through. This is your host, Bernice Butler. Thank you, and listen in again next week for more Healthy Living, Healthy Planet Radio. Thank you.